Picture this. You're sitting at your favorite restaurant with your family. Your grandkids are talking about their week at school. Your daughter is sharing exciting news about her promotion. Everyone is laughing, and you're smiling along, nodding your head, but inside you feel completely lost. You caught maybe every third word. The background noise swallowed everything else. So you just pretend. You laugh when everyone else laughs. You nod when it seems right, but you have no idea what anyone actually said. And later that night, you feel this quiet sadness, this creeping loneliness, even though you were surrounded by people you love. As a physician specializing in older adult health, this keeps me up at night because I see it all the time. People think they're losing their sharpness. They worry about their memory. They wonder if something is wrong with their brain, but what they don't realize is that the real problem might actually be in their ears. Today, I'm going to share a simple hearing check you can do right at home with a partner in about 60 seconds. It's not a diagnosis, it's a screening, a way to get important information about your hearing health. And here's why this matters so much. Research shows that untreated hearing difficulty is linked to faster memory decline as we age, not caused by, linked to. That's an important distinction. But it's a link strong enough that checking your hearing might be one of the most important things you do for your brain this year. By the end of this video, you'll know exactly how to do this test. You'll understand what your results might mean, and you'll have a clear action plan for protecting both your hearing and your memory. So stay with me. Now, before we go any further, I need to be clear about something. This video is for education only. It is not medical advice. It does not replace a proper evaluation from your doctor or audiologist. Please do not stop any medications based on what you hear today. If you have any concerns about your hearing or your health, talk to your healthcare provider. That's who can give you personalized guidance. All right. Let me ask you something. Comment below and tell me your age and where you're watching from. I love hearing from people all over the country, all over the world, actually. It helps me understand who's in this community and what topics matter most to you. Now, let's talk about why hearing and memory seem to be connected. And I want to be very careful here. We're talking about association. Research has found these two things travel together. But that's different from saying one causes the other. Think of it like this. People who carry umbrellas often live in rainy cities, but carrying an umbrella doesn't cause rain. They're connected, but not in a cause and effect way. The relationship between hearing difficulty and memory decline works similarly. They're linked, and that link is important enough to pay attention to. So what might explain this connection? Let me give you a few ideas that researchers are exploring. The first one is something I call brain bandwidth. Your brain only has so much processing power. When hearing becomes harder, your brain has to work overtime just to understand speech. It's like turning up an effort dial. All that mental energy going toward hearing means less energy left over for remembering, thinking, and focusing. Your brain gets tired. And when your brain is constantly exhausted from straining to hear, other mental functions may suffer. The second idea is social withdrawal. When hearing gets difficult, many people start avoiding situations where they struggle. They skip the family gatherings. They stop going to their book club. They eat at quieter restaurants or just stay home. This leads to isolation. And we know that loneliness and social disconnection are themselves linked to faster cognitive decline. Your brain needs social interaction like your body needs exercise. The third idea involves mood, sleep, and stress. Struggling to hear is frustrating. It's exhausting. Many people with untreated hearing difficulty experience higher rates of anxiety and depression. They may have trouble sleeping. Their stress levels stay elevated, and all of these things can affect brain health over time. Let me share a quick story that might sound familiar. I had a patient named Robert, 73 years old. Sharp as a tack his whole life. Retired engineer, loved crossword puzzles. His wife Margaret noticed that the TV volume kept creeping up, little by little, month by month. She'd walk into the living room and the volume would be at 40 when it used to be at 22. Robert said the TV speakers were just getting worse. He blamed the cable box. He blamed the show's sound mixing, but the real issue was his hearing had gradually changed over several years. Once he got a proper hearing evaluation and started using hearing aids, that TV volume went right back down, and Margaret got her peaceful living room back. The takeaway here is simple. If you notice the volume creeping up on your TV or phone, don't ignore it. It's worth checking out. Here's another story. A woman named Patricia came to see me because she thought she was developing memory problems. She was forgetting conversations, missing important information. Her family was worried. But when we talked more, I learned that most of these problems happened in noisy places, restaurants, family parties, situations with lots of background sound. In quiet one-on-one settings, Patricia did just fine. Her memory wasn't the main issue. She was struggling with something called speech and noise processing. Her ears had trouble picking out voices from background sounds. Once we addressed that, her confidence came back. She felt like herself again. The lesson here is that not all memory concerns are actually memory problems. Sometimes the issue starts earlier in the chain with what you're able to hear clearly in the first place. If this information is helpful so far, take a second and hit that like button. It helps more people find this video, and it lets me know that you want more content like this. Now let's get to the main event. The simple hearing check you can do at home. I call it the 60-second speech and noise partner check. You'll need one other person to help you: a spouse, a friend, an adult child, a neighbor, someone who can read sentences to you and listen to your responses. Here's how to set it up safely. First, choose a room where you can control the noise level. A living room or kitchen works great. Make sure you have good lighting so you're not straining to see. Remove any tripping hazards between you and your partner. Sit in a comfortable, stable chair. This is not a test where you need to stand or move around. Now here's the key ingredient. You need to create some low, steady background noise. This mimics real-world listening situations like restaurants or family gatherings. You have a few options. Turn on a fan in the room, run water at the kitchen sink, put a TV on low volume tuned to a talk show. The noise should be noticeable but not overwhelming, just enough to make listening a little harder. That's the whole point. We're checking how your ears handle speech when there's competition. Sit about 6 to 10 feet apart from your partner. Face them directly. Make sure you can see their face, but they shouldn't exaggerate their mouth movements or speak louder than normal. Normal conversational volume, normal pace, no shouting, no whispering. Your partner will read 10 short everyday sentences. After each sentence, you repeat back exactly what you heard. Your partner marks whether you got it right. Here are the 10 sentences to use. Your partner should read these exactly as written. 1. Please close the window before it rains. 2. The dog needs to go outside soon. 3. We're having chicken for dinner tonight. 4. Did you remember to take your medicine? 5. The grandkids are coming over on Sunday. 6. I put your glasses on the kitchen table. 7. The weather should be nice this weekend. 8. Can you hand me the remote control? 9. We need to stop at the pharmacy later. 10. Your doctor's appointment is at 2 o'clock. After each sentence, you repeat it back. Your partner counts how many sentences you got completely correct. A few small word changes might be okay, but the meaning should be accurate. If you said the kids are coming Sunday instead of the grandkids are coming over on Sunday, that's close enough. But if you said the grandkids are going somewhere on Monday, that's a miss. Now here's an important extra step. Do the test with each ear. First, face your partner normally. That tests your overall hearing. Then turn so your right ear is closer to your partner. Gently cup your hand over your left ear to reduce what it hears. Don't stick anything in your ear. Just cover the outside with your palm. Do the 10 sentences again, then switch. Right ear covered, left ear toward your partner. This helps you notice if one ear is struggling more than the other. Let me give you the scoring. If you got 8 to 10 sentences correct with each ear, that's a pass. Your hearing seems to be working reasonably well in background noise. Keep monitoring yearly. If you got 5 to 7 correct, that's borderline. It's worth scheduling a professional hearing evaluation. You may be working harder to hear than you realize. If you got 4 or fewer correct, that's a red flag. Schedule an appointment with an audiologist or your doctor soon. There may be something going on that deserves attention. Now let me share 8 common mistakes people make with this test and how to fix them. Mistake 1. The background noise is too loud. If you can barely hear your partner, even without the noise, turn it down. It should be a challenge, not impossible. Mistake 2. The partner speaks too slowly or loudly. The whole point is to simulate real life. Speak normally. Mistake 3. Sitting too close together. 6 to 10 feet gives a realistic distance. If you're 2 feet apart, the test is too easy. Mistake 4. Doing the test in a completely silent room. You need that background noise. That's what reveals speech in noise difficulty. Mistake 5. The listener watches lips too intensely. A little lip reading is natural, but don't exaggerate it, keep it realistic. Mistake 6. The partner gives hints or repeats sentences. Read each sentence once. No do-overs during the scoring. Mistake 7. Doing the test when tired or distracted. Take the test when you're rested and alert. Mistake 8. Sticking something in the ear to block it. Never put anything into your ear canal. Just cup your hand over the outside. Now, what do your results mean? Let me be very clear. This home check is not a diagnosis. It's a screening tool, like a temperature check. It gives you useful information, but it doesn't tell you everything. Many things can affect hearing. Earwax buildup is extremely common and completely reversible. Congestion from allergies or a cold can temporarily muffle sounds. Ear infections need treatment. Some medications have hearing-related side effects. Chronic conditions like diabetes, high blood pressure, and thyroid problems can affect hearing over time. And here's something important. One ear being worse than the other is common. Our ears don't always age at the same rate. But if you notice sudden hearing loss in one ear, that's different. That requires urgent attention. I'll come back to that in a moment. About earwax. Please don't use cotton swabs deep in your ear canal. You can push wax further in and even damage your eardrum. If you think earwax is an issue, talk to your doctor. They can check and remove it safely. Now let's talk about red flags. These are situations where you shouldn't wait. You should seek care right away. If you experience sudden hearing loss, especially in just one ear, contact your doctor immediately or go to urgent care. If you have sudden severe dizziness or vertigo with hearing changes, that needs prompt evaluation. If you notice new neurologic symptoms like face drooping, weakness on one side of your body, confusion, or trouble speaking, call 911. If you have severe ear pain that doesn't improve, bleeding or drainage from the ear, or sudden intense ringing in one ear that won't stop, these all warrant urgent medical attention. For other situations, like gradual hearing changes or borderline test results, you can schedule a routine appointment. But don't keep putting it off. Sooner is better than later. Let me give you a clear roadmap for what to do next. Step A. Book a professional hearing exam. An audiologist can do comprehensive testing in a sound booth. They measure how you hear different pitches and tones. They test speech understanding in quiet and in noise. If there are medical concerns, they may refer you to an ENT specialist. Many audiology appointments are covered by insurance, including Medicare. Step B. Review your medications and health conditions with your clinician. Some medications can affect hearing, blood pressure, diabetes, thyroid issues, and cardiovascular health all play a role. Make sure your conditions are well managed. Step C. Protect your hearing going forward. Keep the volume reasonable on headphones and earbuds. Use hearing protection in loud environments like concerts, lawn mowing, or power tools. Even everyday noise exposure adds up over time. Step D. Make communication easier right now. Face people when they're talking to you. Make sure there's good lighting so you can see their face. Reduce background noise when having important conversations. Ask people to slow down if needed. These simple changes help a lot. Step E. If recommended, consider hearing aids or assistive devices. Modern hearing aids are smaller and smarter than ever. They may help many people hear more clearly and feel less fatigued. Results vary. Set realistic expectations. But for many people, they're life-changing. Talk to an audiologist about what might work for you. Now, let me give you 5 brain-friendly habits that support both hearing and cognitive health. First, prioritize sleep. Aim for 7 to 8 hours of quality sleep each night. Create a consistent bedtime routine. A well-rested brain processes sound and information more efficiently. Second, stay physically active. Walking is wonderful. Add some strength training if you can. Include balance exercises to prevent falls. Movement increases blood flow to your brain and ears. Even 30 minutes most days makes a difference. Third, stay socially connected. Talk to friends and family regularly. Join a club, a class, or a faith community. Social engagement exercises your brain and gives you reasons to keep hearing well. Fourth, manage your blood pressure and blood sugar. High blood pressure and diabetes can damage the tiny blood vessels in your ears. Work with your doctor to keep these numbers in a healthy range. Fifth, keep your mind active. Read books, do puzzles, learn new skills, engage in hobbies you enjoy. Mental stimulation helps maintain cognitive function throughout life. Now here's a quick Q&A segment to address questions I hear often. Question 1. Can hearing loss be reversed? Sometimes yes. If the cause is earwax, infection, or medication, treating those issues may restore hearing. Age-related hearing changes are usually permanent but very manageable with proper support. Question 2. Are hearing aids hard to get used to? There's an adjustment period for most people. Your brain needs time to adapt to sounds it hasn't heard clearly in years. Patience and follow-up with your audiologist help tremendously. Question 3. Does insurance cover hearing aids? Coverage varies widely. Medicare currently has limited coverage for hearing aids but does cover diagnostic hearing tests. Check your specific plan or ask an audiologist about options and financing. Question 4. What if I'm embarrassed about wearing hearing aids? Modern hearing aids are often nearly invisible. Many people won't even notice. And honestly, asking people to repeat themselves constantly is more noticeable than a small device in your ear. Question 5. Can loud noise still damage my hearing at this age? Absolutely. Noise damage can happen at any age. Protect your ears in loud environments no matter how old you are. Question 6. Should my spouse get tested too? Yes. I encourage couples to both get tested. Hearing difficulty often goes unrecognized because a partner compensates. Getting tested together supports both of you. Before I wrap up, here's your Do This Today checklist. 7 simple items. 1. Find a partner and do the 60-second speech and noise test I taught you today. 2. Write down your score for each ear. Keep a record to track changes over time. 3. If your score was borderline or red flag, Call to schedule a professional hearing evaluation this week. 4. Look at your TV or phone volume settings. Have they been creeping up? 5. Think about situations where you struggle to hear. Make a list to share with your doctor or audiologist. 6. Check if you have hearing protection for loud activities like lawn mowing or concerts. 7. Tell one friend or family member about this video and encourage them to take the test too. Let me give you a quick recap. Hearing changes and memory changes often travel together. We don't fully understand why yet, but the connection is strong enough that taking care of your hearing may support your brain health. The simple test we covered today can reveal whether you might benefit from a professional evaluation. And if you do have hearing difficulty, there are real solutions that may help you stay connected, confident, and sharp. Please remember, this video is educational. It's not medical advice. If you have any health concerns, talk to your doctor or audiologist. They're the ones who can give you personalized care. If you found this helpful, subscribe to the channel. I post videos regularly about staying healthy and independent as we age. And before you go, drop a comment and let me know your score. Did you pass? Were you borderline? Did you discover something new about your hearing? I read the comments, and I'd love to hear how the test went for you. Take care of your ears. They do so much more for you than you might realize. And taking this simple step today might just be one of the best things you do for your brain tomorrow. Thank you for watching. I'll see you in the next video.